As you heard, I'm not Gabriele Calizzani. Gabriele was coming, and this morning he was asked not to leave Italy due to an emergency related to his work. As you know, he works for the government, for the blood transfusion service in Italy. So he sent his slides in this morning. So I've got one advantage over you. I've seen the slides once this morning. So I apologize if I'm not going to give the whole message of what he was going to say. However, he has a lot of slides, and I'm aware of the time. So to leave some time for questions, I'm going to go between, there are 10 slides that deal with the process, that what's happened. So I'll go through those very quickly and try and concentrate on some other issues that are more important. So what he was going to talk about is a project going on in Europe to categorize all European haemophilia centers so that people know what we're dealing with each center throughout Europe. This is part of a project called the EUHANET project, and the aim of the EUHANET project, as you can see from the bottom, is to harmonize and improve the care received by European citizens with inherited bleeding disorders. So basically, this is a European level project. There are a number of partners here, and the key that I wanted to point out to you is that the European Haemophilia Consortium is one of the partners in this project. And what I'm going to present to you is the work package that the European Haemophilia Consortium has been leading. And so all of this work arose from the European Haemophilia Consortium. There is a website that I would encourage you to go to. It's euhanet.org. And I think if you visit it, you'll find a lot of helpful information, much more than you can imagine. There are 4 components. There is a website which is incredibly valuable information. Go and have a look at it. There is adverse event reporting, which I'm going to give you a talk later about. There is this part, which you're going to talk about now, and Flora is going to talk about the rare bleeding disorders issue tomorrow. So the objective of this package, which, as I said, was led by the EHC, was to provide a guideline document on how to certify haemophilia centers into treatment centers and a higher level of comprehensive care centers. So the next 10 slides deal with the process of how this was developed. Basically, there were lots of meetings and loads of milestones that were followed. At each level, there was a consultation. The first consultation, all the documents that are currently available in Europe were brought together and assessed and to develop the process. Then there was an initial definition put together. There was a second consultation that went around Europe, and there was 56 questionnaires from 26 EU and non-EU countries responded about what should be the definition of these centers and how we should move forward during the development. So this was dealing with the development of the process. Then all the standards from the different countries were put together and indexed with each other and cross-referenced. It was quite a big job that took a year to put together. And the European guideline was key. There is a document in Italy about the models of care that was also used. And then in February of this year, there was a further consultation process on the development of the guideline up to that point. And as a response to this process, amazingly, there was 170 responses to the questionnaires as part of the consultation. And this was by patients, patient groups, doctors, and other healthcare professionals. And they came from all of these countries. You cannot see it, but basically it was wide consultation. As a result of that, the document was modified, and there was even a further consultation to make sure that the document that was produced at the end was approved. As a result of the process, the EHC has produced a pro forma that has actually been modified since then. And this was the guiding document that was produced. These are the European guidelines for the certification of hemophilia centers. So I went through it very quickly. It's a year's work by 3 people. And this is the guideline is freely available on the internet. I'm sure if you contact the EHC, they will direct you to it. If you got the EUHANET website, you will see the document there. And the document was launched in Rome. There was a meeting in the National Blood Transfusion in Rome. I think it was the 11th of July, and that was publicly launched. So the aims, I'm going to take you through it and give you the key points from this document, was to set the quality standards for European haemophilia centers. So there are 90 standards in this document. I'm not going to go through all of them. And the whole point was to ensure equity of treatment throughout Europe. You will, I'm sure, come and tell me that it's very difficult to achieve all this because you heard from the previous talk that there is a 10-fold difference in the GDP of different countries. But this is not always just about money. You should have an aspiration to achieve it, and actually you can achieve quite a lot. So essentially this document deals with all bleeding disorders, not just hemophilia. So the rare bleeding disorders are also taken care of, and it deals with adults as well as children. The document does state about the delivery of care, and the key point is that it's suggested that there should be 2 levels of hemophilia care centers in Europe. There should be the European haemophilia centers that tend to provide local care, and then the comprehensive cares. You've heard about my center, you've heard about the Timisoara Center that are providing comprehensive care center. So a point that is made in this document is that all patients with bleeding disorders in Europe should have access to comprehensive care center. So this can be either directly because you're registered with one of these centers, or if your primary center is here, you should be able to access this center through here if the services are not available in your local center. The document deals with functions and activities. It deals with the minimum number of severe patients. It deals with the provision of expert care, the laboratory tests, and the integrated approach. And there will be a slide on each of these 4 points coming up about how the document deals with it. The first one is the number of patients registered. As mentioned, you need a certain numbers to maintain an expertise. And actually, this document suggests that you should have 40 severe patients. Sorry. For a comprehensive care center, you should have 40 severe patients normally. Okay? A committee will look at this. You don't actually always have to have that number. It depends on your situation. But normally it would be 40 severe. When we started before, we assumed that the European Haemophilia Center, Haemophilia Treatment Center, should not have a lower number. But the consultation that had 180 responses amazingly said people in Europe felt that that should not be the case. And as a result of that consultation, it suggested that you should have at least 10 patients to be able to call yourself a haemophilia center. Again, normally that would be the situation. In terms of functions and activities, this is the 24-hour care. Basically, it's expected that the comprehensive care center should have a hemophilia expert 24 hours a day, and they should be able to manage surgery and deal with inhibitors, whilst the local center should be able to provide the treatment as a first line, and if they cannot cope, then refer them on. In terms of the laboratories, essentially the principle is the same. The Comprehensive Care Center provides a wider range of tests available all the time, whilst the Hemophilia Treatment Center provides a smaller number of tests that do not have to be available all the time. In terms of functions, sorry, this is still in the laboratory. In terms of the integrated approach, I already mentioned in the previous lecture that the Comprehensive Care Center provides access to all of those specialties. The Hemophilia Center basically does not have to provide those. However, they have to have some arrangement to get those services provided. For example, you do not really have to be able to do inhibitor patient surgery in a hemophilia center, but you have to be able to, if you have a patient with an inhibitor, be able to refer them on to get the surgery done. The way this is going to work, the process is going to open in about 3 weeks' time. It's going to be actually, there is even another official launch at the European Parliament on the 17th of October of this process, and centers will be able to apply and a committee will assess the applications and give the adjudication. So these really, although I'm presenting this, I'm here under false pretenses really, because these are the people that did all the work. So Gabriele was the leader of the work package that delivered this. Paul Giangrand was the hemophilia expert for this package. And really, Paul was the second choice, and he was going to be delivering this lecture today. But unfortunately, Paul is leading a workshop upstairs, so he couldn't do it. So I'm afraid I'm the third choice. So you have to bear with me. Fabio was the coordinator that did a lot of the work. There was another key person called Ivana Menichini, who was a methodologist. And this is an amazing concept to me, being a clinician, that you have got a methodologist on how to work out this package. And she's a professional methodologist on how to do this. She was employed on this package by the EHC. And then you've got 3 members of the EHC that closely involved that you know about, Brian, Joe, and Amanda. Thank you.